Hello, welcome to today's webinar, Secrets to Successful Inpatient Glycemic Management Programs. Thank you for joining. Inpatient glycemic management can be challenging for the healthcare team. Patients' insulin needs vary widely, internal resources are increasingly stretched, and achieving consistent good outcomes can feel unattainable. Today, our panelists will share their knowledge and experience on ways they and their organizations successfully manage this challenge. My name is Spring Moore, and I will be the moderator of today's discussion. My background is ICU nursing, and I spent over a decade at the bedside before moving to a clinical liaison role for glycemic management software. It's a pleasure to work as a clinical services specialist for Monarch Medical Technologies, the provider of EndoTool. EndoTool is an FDA-cleared clinical decision support software application used in the inpatient settings to achieve and maintain glucose control. Our co-host today is Dr. Paul Chidester, Monarch's Chief Medical Officer. Paul's medical training and background as a nephrologist provide invaluable oversight and guidance for our team. His prior experience includes a leadership role at a large healthcare organization where, incidentally, he had the unique opportunity to spearhead the successful implementation of a glucose management program across several facilities. On our agenda today, we will talk about building the glycemic A team, tips for implementing an effective glycemic management program, and education strategies for success. Our panelists are an amazing group of individuals with a wealth of knowledge to share. Each one will introduce themselves and, for context to our discussion, share their organization's journey with glycemic management and when a glycemic management software program was introduced. Jennifer, do you mind to begin?
I don't mind. Thank you so much, Spring. My name is Jennifer Nopet. I'm a pharmacist and a pharmacy manager for Atrium Health, which is now a part of the health system Advocate Health. My role as pharmacy manager is in medication safety and quality for the Southeast region of Atrium. I work alongside teammates in North Carolina and Georgia at Atrium sites to improve med safety. Although I've been in a regional role for about 18 months, I've spent my entire career prior to that at Atrium Health Wake Forest Baptist. An important part of my work has been as pharmacy chair of the glucose management subcommittee, and work alongside the section head for endocrinology. There's always been a presence of glucose management practices at Atrium Health, but that subcommittee has been in place for over 10 years now and works with our pharmacy and therapeutics committee on all things glucose management. EndoTool has been in place at Atrium Health Wake Forest Baptist since March of 2022. Thank you.
Thank you, Jennifer. Megan, do you mind to go next?
I'm Megan Hopkins. I am the nurse practitioner, one of the nurse practitioners at Centennial Medical Center in Nashville, Tennessee with HCA. We started the glucose management team in 2015. There was always the presence of endocrinologists, but most of diabetes was managed by our hospitalist group. So this was a big push to improve glycemic care inpatient. Part of that was using IV insulin drip software to improve our patient care in the ICU and length of stay. So we implemented EndoTool in spring of 2017.
Thank you, Megan. Christy?
Sure. Hi, I'm Christy Musa. I'm the DCOI, or the Director of Clinical and Operational Informatics for UPMC. I support 7 hospitals in central Pennsylvania. In this role, I liaison between nursing operations and our IT and technology team to manage and monitor ongoing projects anywhere where nursing practice and technology intersect. As for glucose management programs, they've been in place for quite some time in all of our hospitals. We have a very active diabetes committee that looks at various performance measures across our 7 campuses. We went live on EndoTool in August of 2022.
Thank you, and I'll turn it over to Paul for the next 2 slides.
So why should a hospital an organization focused on inpatient glycemic management. It's a key part of many patients that enter the hospital into the management of their diabetes. 1 in 3 patients that are hospitalized are likely on insulin or other forms of diabetes management. And if this is not managed well, there's a real potential for patient harm. Back in the day when I was in hospital leadership, we had several patients die because they were managed poorly with their insulin. And if they're not managed properly, in addition to harm, there's an increased cost of care. There's been one study that's shown if a patient has an episode of hypoglycemia before they're ready to be discharged, they're going to be in the hospital for another day. And we have data with a number of our clients that show with improved glycemic management, the length of stay is lower and there's less time in the ICU. There's increased visibility on glycemic outcomes. There's now reporting to CMS with an electronic clinical quality measure of the rates of hypoglycemia and hyperglycemia. So that's just another area where potential patients can judge a hospital's performance and make a decision if that's where they want to receive their care. And then there's a lot of variation in the delivery of care for patients with diabetes, multiple order sets that often exist within a hospital. And there's often substandard types of care utilized, such as sliding scale insulin. So the development of a glycemic steering committee can really address all of those issues. And when you look back at how diabetes is managed in the hospital, there really is no one owner of how diabetes should be managed. So that's where it's very important to have a glycemic steering committee. That committee can look at what education is really needed for nurses to better care for patients. That committee can monitor outcomes to see where there needs to be extra focus placed. And that committee can look at available technology to help enhance the care. Shown on this slide here are the results of our institutions from the 3 panelists, as well as all of our EndoTool customers that have made a decision with their glycemic management committee to leverage technology. And that technology is EndoTool insulin dosing software. And you can see that all of these institutions have very exceptional outcomes. Most hospitals will have a hypoglycemia rate less than 70 without using this technology of greater than 2%. And all of these sites actually did have rates greater than 2% prior to launching EndoTool. And you can see that the rates of severe hypoglycemia, which is one of the measures that CMS is now tracking, are almost non-existent. And a real shout out goes to HCA TriStar, which has had no hypoglycemic episodes less than 40 in the last 18 months. And then also, as CMS is tracking hyperglycemia, you can see very, very low rates with the use of EndoTool.